What is terminal weaning? Terminal weaning is that when the patients are unable to maintain their ventilation due to injury or illness and have no expectations of being able to live off of the ventilator independently. This process involves the respiratory therapist to go in and remove the patient from the ventilator and provide a form of supplemental oxygen until the patient passes away. There are two methods of terminal weaning. The first method of terminal weaning is to remove the assisted ventilation but leave the endotracheal tube in place. The second method is called terminal extubation, and that is to remove the endotracheal tube and the ventilator at the same time. It is most appropriate to remove the ventilator and leave the ET tube in place to maintain the patient's patent airway and to help manage their secretions. You would do a terminal extubation if the patient has experienced brain death. The things that cause ethical dilemmas for respiratory therapists are the respiratory therapist feels like they are turning their back on their religious beliefs by removing the patients from the ventilator and allowing them to pass away naturally. They feel like this is a betrayal because they are supposed to do no harm and take care of their patient, and they feel like they're causing their patient harm when they do this. Also, it's hard for a respiratory therapist ethically when the patient is requesting you to remove the life support for them. They just feel like they're betraying them as well. Terminal weaning is a difficult part of a respiratory therapist's job. And for a respiratory therapist who is having issues with terminal weaning, it's good to have a good support group in place, and to have like a debriefing after terminal weaning for the respiratory therapist. And it's also good to have them be able to rotate their schedules with other respiratory therapists, so they're not the one who is always having to terminally wean a patient. So this is just good to help out your respiratory therapist with. And then these are all the references I have used.